I think a lot of the stuff on these slides are self-explanatory, but I'll read through them with you and emphasize some key points. But every patient deserves, obviously, your undivided attention, consideration, and care. What you need to remember is that when a patient comes into the hospital, number one, they're sick, they're scared, they're not feeling well, and the more professional you are, the more comfortable they're going to feel. So all patients feel vulnerable, whether they appear to be ill or not, and every effort should be made to gain their confidence and put them at ease. So that is part of your job, to make them feel comfortable. And hopefully you went into this field because you do care for people and you do want to make a difference. So interpersonal skills. It's always important that you dress professionally, which is why at Kaiser we have a dress code. No tattoos that are visible, those always have to be covered. No funky earrings, multiple earrings, usually one is allowed, no crazy nails, things like that. So that's all part of being professionally dressed. You want to always wear a visible identification, basically a badge. You're going to get one when you go out on clinicals, and it's going to have your name, and it's going to let the patient know that you actually work there. Okay. And when you address patients, you should always be respectful and professional as well, using their first and last name, mainly because if you're going to call a patient into the room, it's important that you call their first and last name, because if you say Mrs. Smith, there may be more than one Mrs. Smith sitting in the waiting room. So you always want to address them with their first name. And also, once you get them in the room, you want to ask them for their birth date, to make sure that, again, there aren't two Jane Smiths, because Smith is a very common name, and believe it or not, you will have a lot of people with the same name, so you definitely want to double check their birth date as well. During the ultrasound examination, obviously the well-being of the patient is your responsibility. You want to establish a good rapport with the patient and proper patient care techniques to ensure their safety. If there is a problem, if the patient falls, sometimes a lot of your patients are going to be older, they're going to need assistance. They might be in a wheelchair, they may have a walker. If they need to be able to get onto a bed, if you don't think you can assist them, you need to grab somebody else that can help you, so that, again, we don't have any falls or incident reports that you're going to have to fill out some additional paperwork for. Introduce yourself. Make sure that you make them feel comfortable, that your tone is genuine, that you're actually listening to your patient. Make sure that your conversations are always professional and respectful. And you shouldn't have your cell phone on. You shouldn't answer it unless, of course, it's important or it's something to do with the hospital. But again, you need to make them feel as if they are the most important person, and they are. They're your patient at this moment. So that's part of professionalism. Again, you want to have a good rapport with your patient. You want to make them feel comfortable. You want to, again, relax them. A lot of times they're tense. And even, and this is something I found that was very helpful, if your patient's in a bad mood or they're grouchy, that doesn't mean you need to be grouchy back. Kill them with kindness. The nicer you are and the more understanding you are, that can change their attitude completely. Sometimes, like I said, they're just grouchy because maybe they've been waiting for an hour and they're in pain. And maybe you guys were backed up, or who knows what happened. Maybe it took them a long time to get checked in or find the parking space, or whatever the reason might be. So just because they're angry or they're not being respectful doesn't mean you shouldn't be. Because once they see what calm demeanor you have and good attitude you have, they're more likely to apologize for their behavior. And I've had this happen a lot where patients were upset because they were sitting in the waiting room for extended periods of time, and they go up to the front desk and they would say, you know, I don't know how long it's going to be, and then shut the window on them. Of course, they're not going to be in a good mood. So what I would do if I had to make my patients wait because I was still with a patient, I would go out there, I'd sit down next to them, put my hand on their knee and say, I'm so sorry, I know you've been waiting a while. I got backed up. It's going to be probably another 15, 20 minutes. You're welcome to walk around, come back. You just keep them informed as to what's going on. 9 out of 10 times you will not have an angry or upset patient. It's pretty easy to make them feel comfortable. You want to get a medical history from your patient. Now there are medical charts that are going to have information. You want to definitely check your request for the ultrasound, make sure it was definitely ordered. And avoid using medical terms that the patient's not going to understand. They may not know what a cholecystectomy is. So you don't say, hey, did you have a cholecystectomy? And they're going to not know or be comfortable with that term. You have to say, did you have your gallbladder removed? Did you have any surgery? Whatever it takes. I mean, don't use words that they can't understand. That's going to make them feel uncomfortable. And when you're trying to figure out what's going on, regardless of what's in their medical chart, you need to ask them questions. Where exactly is your pain? How long have you been experiencing that pain? What kind of pain is it? Again, did you have any surgeries? Obviously relevant to the area of interest. And the more you listen, the more comfortable they're going to feel. Begin by gathering all available information from the patient, their charts. Look at the request form. Be a good listener. Pay close attention to the patient's answers. Write them down. Again, it's your job to figure out what's going on. That's why we're sonographers and we're not ultrasound techs. We take that information and then we try to figure out what we're looking for, and we have to search for it. So if somebody presents with right upper gastric pain and it's been going on, or they only have pain after they eat, it sort of radiates to the right shoulder. This is all the stuff you've been learning in class, and now you're preparing for, you're going to put into practice. So it is ultimately your job to present the radiologist with the accurate information. Ultrasound exam room, okay. You want to make sure that the exam room is patient ready. You've got your gel bottles full. The room is clean. You don't want to bring a patient into the room and just to find out you have to clean the transducer off, change the bedding. That's not very professional. You want to have all of that done before they enter the room. So there should be no clutter, no personal items, and ultimately, of course, no gel on the transducer from the previous patient. They shouldn't have to witness you cleaning the room. You should have that already done before they enter the room. Stock the gowns. Make sure there's pillow covers. The scan gel bottles are full. They're warm. The gel is a comfortable temperature. You've got enough towels and cloths. You shouldn't have to leave the room to get any of these things. You want to do this prior to bringing them back. Make sure, again, they've got sheets and blankets. Patients get cold, and there's nothing wrong with offering them a blanket. You just need to expose the area of interest. If you're doing a carotid, you can definitely keep their body warm by giving them a blanket, because the hospitals are kept cold to minimize infection and the spread of germs. So it's going to be cold in most hospitals and even in outpatient centers. So make sure you offer them a blanket. They should be very comfortable when you're scanning them. Make sure there's enough gloves, drapes, emesis basin in case they throw up. That happens a lot. Alcohol wipes, waste containers, dirty laundry bin, sharps container. And when you go out on clinicals, they're going to hopefully show you where all of that stuff is. Hand sanitizer, whatever that they have, at least wash your hands on a regular basis. The angled sponge, basically it's like those wedges that you can put below their back, under their neck, whatever, to help position them. If the patient has to turn decubitus and they can't really stay on their side well, you can put one of those angled wedges there so they can kind of lean back on that. You should have sterile ultrasound gel, packets of gel, in case you need to do a sterile procedure. Even if they have an open wound or they just had surgery, and this happens a lot with carotids, they may have had an enderectomy, and now we need to scan to look and see how patent the vessel is. Now, if it's still fairly new, you're going to put a probe cover on, and you're going to use sterile gel. Okay. You should also have a variety of needles, syringes, tubing, and anything you might need for any procedures you might be performing as well. Patient care during the ultrasound exam. Always use universal precautions. If the patient's in isolation, or if you need to wear a mask, or they need to wear a mask, or both of you do, make sure you have that stuff available. Instruct and, if needed, aid the patient undressing, gowning. And another thing you may not think is your job, but if your patient comes in and they have any kind of accident, or they vomit, or they soil themselves, it's your job to help them undress. If they're in your room, you want to help them clean up, all that kind of stuff. They may be coming from a nursing home and they have a diaper on, and you just don't let them sit in that. You're going to get another one, and you're going to help them, and you're going to change that. That is part of your job as a healthcare provider. So, and you're also going to assist your patient onto the examination table. And like I said, if the patient, say maybe they're big, you don't think you can do this by yourself, or they're unstable, absolutely get assistance. Don't try to do that if you don't think you can do it by yourself. Assisting patients onto examination tables. With wheelchairs, make sure you lock the brakes. That's like a really important thing. You don't want the chair to move away as you're trying to get your patient up. Move the legs in the front. These are little things, but the more you work in a hospital, the more you're going to realize how you could forget to do this if you're not used to working in a hospital. But they have those moving legs in the front of the wheelchair, like right here, and that's what they're talking about. Move the legs and the footrest out of the way. Use proper body mechanics when assisting patients. You don't want to put too much stress on yourself either. With a stretcher, avoid bumps into the wall, lock the brakes. And if you have to move your patient from a stretcher over to a table, a lot of times we just scan them on the stretcher, but if you have to move them, you want to make sure you get the proper, they're like these little boards that you slide under your patient, and they have handles on them. You slide that under your patient with the sheet on top, and then it makes it easier for you to move your patient from one stretcher to your table. And again, get assistance if you think that this is something you can't do on your own. You have to assist your patients with medical equipment, their IV poles, their oxygen. Before a patient gets on or off the examination table or stretcher, make sure that it is stationary. Make sure the brakes are on. Always have a handle, step stool, so that the shorter patients can get up on the tables. If they can't seem to reach, you need to be able to help them. And definitely, they usually have the handled type, so they can hold on to something or hold on to you. You want to help your patients get out of the wheelchair. Make certain that, again, the brakes are on both the bed and the wheelchair. And if the patient is already on a stretcher, avoid bumping into the walls when wheeling the stretcher into the examination table. And again, I know this stuff is stuff you could read through, but again, the whole point of going through this is to make sure that you are attending to your patient. You want to make sure that they feel comfortable. Often they're confused, they're scared, they're upset, and sometimes they're uncooperative. And they may have an Alzheimer's patient, a dementia patient, and they can get very irate or even combative at times. If that's ever the case, always, again, ask for assistance. Patient care during the ultrasound examination. See that the patient is comfortable. Explain the procedure. You definitely want to tell them exactly what you're going to do before you do it. You want to explain to them, again, depending on what the procedure is, if they need to pull up their shirt a little bit, give them some towels, tell them you're going to be placing gel on their body, you're going to be moving your ultrasound probe around the area of interest. You might be pushing a little bit. It might be a little bit tender. Again, they need to know what to expect before you do the exam. Tell them you might be asking them to hold their breath, change their position, or whatever it might be. So tell them all this before. And another really important thing to do before you scan is explain to them that you can't tell them the results. I always would tell them that beforehand. That way they'll avoid asking. You can say, I'm just doing the exam. I'm not allowed to tell you good, bad, or indifferent. That's basically what I would say. So if you ask, I might get in trouble, and they'd always feel like, okay, I don't want to get you in trouble, so they would not ask. Or if they do ask, they'll say, oh, that's right, I know you can't tell me. And honestly, you should never tell them anything. That could come back to haunt you. So be prepared to answer patient questions. Explain to the patient that the sonographer does not make the diagnosis, just what we talked about, that you're just going to provide the information to the physician. And the final results will be sent to their referring physician. Usually I tell them in about 2 to 3 days, so they're not expecting results the very next day. But if something is important and it's stat and requires immediate attention, they'll probably get a phone call right away. But I always tell them about 2 to 3 days before they get the results. And then if they get it sooner, then again, that's no big deal. At least they're not waiting that day. Providing anything beyond that is not sensible, responsible, or legal will open you up to the same liability as the physician. So you probably don't have medical malpractice. We can get malpractice insurance. It is fairly reasonable. It's not that you have to, but if you think you have a tendency to constantly tell them what you found, you may want to get malpractice insurance, because that is not your job. And you have to understand that whenever you do something unprofessional or you tell them something, you can be held legally responsible for that. So at all costs, you want to avoid sharing information that you're not the physician. You don't have the authority to do that. So make sure you understand that there's things we can do and things we cannot do, and we don't diagnose. And we certainly don't tell the patients. And what I would tell them is, I can't tell you anything, and they'll try to get it out of you by saying, oh, come on, you must know what you're looking at. You're doing the exam, you know what you're looking at. And I would say, yes, I do, but if I tell you anything, your doctor would be very upset with me, and I could lose my job. And usually, again, it will stop right there. They won't ask for any more information if they feel that that's going to get you in trouble. Asepsis. Okay. The procedures and practices used in a clinical setting to protect patients from infection due to germs. Obviously, that's a big problem in hospitals. There's a lot of staph infection that goes around, and bacterial infections that are passed from patient to patient. And a lot of the times it could be our fault if we are not washing our hands or disinfecting our transducers or cleaning the room properly. So it's important that we take measures to prevent this from happening. Patients that are undergoing invasive procedures can easily get infected through a contaminated environment. So we want to make sure that when they have contact with the equipment or the environment, that it is definitely clean and disinfected before we proceed with the procedure, because again, infection is so easy to spread just because people are just a little too lax with it. I think it's mainly because they're just busy. They don't think about it, but hand washing is one of the best ways to prevent infection. Okay, adequately assist the physician in an ultrasound-guided percutaneous procedure and to protect the patient from obtaining a possible infection during the procedure. A sonographer must be adept at implementing asepsis techniques. Again, basically keeping the room clean and as sterile as possible. This is basically just what the other slide said. All patients are susceptible to infection, especially those with burns, because your skin is your first protection against infection. So anybody with burns or burn victims are very susceptible to infection. So usually a burn victim dies from infection than the actual burn, because they just don't have that layer of protection. People with immune deficiency disorders are more susceptible. They don't have the natural defenses that others do, which is why even with COVID-19, that people that have any pre-existing conditions are going to be more susceptible to developing a more severe form of COVID-19 or any infection. Make sure your equipment is sterile. Wear sterile gloves, face masks, eye shields if necessary. Patient prep, you're going to clean the area with an antibacterial solution. Make sure you practice sterile procedure. There are several videos in all of these PowerPoints. You're going to notice that there's tons of video links, because you're not going to get the hands-on until you're out on clinicals. The best we can do is watch the videos until you actually get out there and do the procedures. So make sure you're watching every single video, because I will be asking you questions about all of this stuff. And make sure you study quite a bit, because I know for me, when I look at this stuff and I think, oh, this is common sense, but then when I'm in a testing environment and you have to like list something, it's harder to recall all these steps if you actually don't study. So it isn't common sense. You definitely want to study and make sure that you understand all of this stuff. Patient prep. The accepted practice is to clean the site using a circular motion, starting with the center of the site and moving outward. Sterile field. There are some sterile trays. And again, if you're watching the video, they show you basically how you're supposed to open the sterile tray, how you're supposed to reach for things in the sterile field, how you're supposed to cover your probe. The one thing you don't want to do is mess up the sterile field, because then we have to start over. So like I said, click on all the video links. There's tons of them all throughout the course, and make sure you're watching all of them. I put them all up there because I thought they were good videos that would really help you understand that procedure. And basically, that's the end of this lecture. The next lecture, the last one for week 1, is kind of a review of all of this stuff. So make sure you read through that one. I'm not going to do a audio with that, but just read through it. Make sure you are doing the chapters in the book and the questions in the back of the book. Make sure you're doing the assignments in the workbook, because that's where we're going to get all the questions for your first quiz. So we'll have a review on Thursday. I'll send out a notification for that. But the last PowerPoint you're just going to kind of read through, and it's basically just more of the same stuff, just to make sure it's all sinking in.